I apologize for the video cutting off. We are now moving on to our patient Julia Child. We're going to pull her up in the MAR. Julia Child, date of birth is 12/12/12. Here for a diagnosis of burn to the hand. A doctor who has prescribed 1 glass ampoule IM. So we are going to, once you do your first check, you're going to go ahead and go to the Texas. Let's get 1 glass ampoule. I'm going to go ahead and pretend this is it. We are going to do our second check for preparing the medication. The patient's name is going to be Julia Child, date of birth 12/12/12. She's here for a burn to the hand. She has no known drug allergies, and Dr. Who prescribed 1 glass ampoule. I'm going to go ahead and put some gloves on. With the glass ampoule, we actually have to break it before you're able to prepare it. I'm going to clean the surface of the ampoule. Getting our injection ready. I'm going to go down. Aspirate first and then pull the medication down. Okay. You're going to throw the safety back on the needle. You're going to throw the glass ampoule in the sharps container. Before that, I missed the step of actually checking the expiration date of it. It's going to be 3/12/2016, which actually looks like it is expired. So before preparing the medication, you are going to want to call a pharmacy to send you a new dose with a proper date. Removing our gloves. Now that you prepare the second IM injection for the day, you're going to do your second check. It's going to be for Julia Child, date of birth 12/12/12. Here for a diagnosis of a burn to the hand. She has known drug allergies, and Dr. Who ordered 1 glass ampoule for her burn. So we are now going to go to our patient's room, begin by knocking on her door, closing the curtain for privacy. Hi Julia, my name is Bianca. I'm going to be your nurse for today. With Julia being a minor, she is going to have her guardian here. I'm going to ask Julia if she's able to state her name and date of birth for me. And then I will ask her guardian to do the same for our third medication check. Julia Child, date of birth 12/12/12. Here for a diagnosis of burn to the hand. She has no known drug allergies, and Dr. Who ordered 1 gas ampoule. Hi Julia, so like you know, I'm pretty sure you've had an injection before. It is going to be a little sting, but it is going to help you feel a little better with the burn that is on your hand. Do you have any questions? Where is the shot going to go? The shot is going to go on the meaty part of your lip on the side of your thigh. So once you have did your third medication check, and actually before, if you touch the patient, make sure you hand hygiene. So now we are going to put on our gloves. Julia's size is going to be this model for me. You are going to clean off her leg where the injection is going. Remove the cap off the needle, go at a 90-degree angle, and inject. Pull off. Since we are reusing the needle, we're going to go ahead and do the one-hand capping method. Then we would throw into the sharps container. Wipe off if there's any little blood, put a band-aid on. Okay, Julia, your leg might be a little, you're going to remove your gloves. Begin hand hygiene. Okay, Julia, your leg might be a little sore. That is completely normal. It is the medication's way of spreading out to help the burn on your arm. But if you notice you feeling itchiness or rash, or you're having some diarrhea, please have your mom or you use your collar right here next to you and let me know. I'll be back in 45 minutes to see how you're doing. Before you leave the room, hand hygiene and document that Julia received her IM injection. Our last medication for the day is going to be for Linda Belcher. We're going to pull her right up the MAR. Linda Belcher, date of birth 9/4/1972. Here for a diagnosis of atrial fibrillation. She has no known allergies, and Dr. Who ordered Coumadin 5 milligrams PO daily for atrial fibrillation. We're going to go ahead and go to our Pyxis. Pull up Coumadin, that is the tablet form, 5 milligrams. We're going to check the expiration date, 10/20/37. We're going to do our second medication check. It is Linda Belcher, 9/4/1972. Here for a diagnosis of atrial fibrillation. She has no known allergies, and Dr. Who has ordered Coumadin for 5 milligrams PO. Okay, so we are now going to, once you have your medication ready, we are going to go to the patient's room, knock on the door, close the curtain for privacy. Hi Linda, my name is Bianca and I'm going to be your nurse today. I'm here to give you Coumadin to help with your atrial fibrillation and hygiene. Hey Linda, do you have any questions on Coumadin? Have you taken it before? If she responds no, just let her know. It prevents from any blood clots forming in your heart since it's beating a little faster. One thing you do want to look out for, since you have never taken it before, with you having an IV or any other puncture wound from an injection, or if you have a second IV, we're going to be coming in frequently to make sure you're not having any excess bleeding. Do you have any questions for me, Linda? We are now going to do our third medication check. Name, Linda Belcher, date of birth 9/4/1972. She's here for an atrial fibrillation. Allergies, she has no known allergies. Dr. Who ordered Coumadin 5 milligrams PO daily. Okay, Linda, would you mind having a sip of water for me so I can make sure you have no issues swallowing? Once you are monitoring that her swallowing is okay, you're going to go ahead and give her the Coumadin, which is the tablet. Here you go, Linda. Here's the medication. Have a sip of water. Once she has swallowed the medication, you're going to throw the trash into the container. Hand hygiene. And like again, Linda, if you have any questions, please let me know. We're going to be making sure, monitoring you very closely, especially you having 2 IVs, to make sure you're not having any excess bleeding. If you're experiencing diarrhea or any pain, please let me know. That way you can contact your doctor. Before you leave, document that Linda was giving her Coumadin. And here's your caller, Linda. If you need any help, please ring the nurse's line and I'll be right in. And that's our demonstration for today.